Hello, my name is Christopher South, and I'd like to do a little bit something different today as far as the anatomy, physiology in the real world. And we're going to get really real today because this is absolutely in the real world and it's something, well, that all of us experience. Um, Something that some of us do every day and some of us not as often as we probably should. But is one of the functions of our body is to eliminate the things that come into our body. And so we're going to talk about today is asking yourself what your poo is telling you. And so I hope that you enjoy this. It's a little bit different and it's something I think we'll have a little bit of fun with. So let's ask ourselves, what is our poo telling us? Well, we all do it. Everybody. From the time that you're born up until about the time that you die. If you're bringing something into your body has to eliminate what it doesn't need. And so the function of the gastrointestinal GI system is to break down food into smaller molecules that the body can use for energy, growth, and repair, and then to absorb all these nutrients and eliminate that waste. So let's look at it a little bit differently. So our GI tract. So think about your GI tract. Okay, there's a picture of it right here. It shows your GI tract basically goes from your mouth all the way through your body, and it actually ends up going out of your anus and hopefully into the toilet if you're nearby one. Um, if you're a camper like me, sometimes, well, you don't have a toilet and you have to make one of your own, but either way, it's going to go in you and out of you. So think of your GI tract as a super highway with lots of scenic stops along the way. And you can see there's lots of little scenic stops in there. And your food is like trucks on the highway filled with things that the body needs. So when you're driving along the highway, you probably see, especially this time of year, we see all kind of grain trucks and different trucks going along the highway with all kinds of things that they're going to deliver to different places. And when they deliver those to different places, that truck is going to be empty. But unlike the trucks on the highway that are going to go and pick up more things, well, we have to think about the trucks that are in our body, which is the food that we've eaten. Well, those trucks are going to get disposed of. All right. And once that truck is empty, the body has to eliminate it and wait for the next shipment, which is the next time that you're going to eat. Well, what's cool, if you think about it, is you can actually look into where that truck, that food has gone through your body, and it can tell you a lot about your own health. And you're going, oh man, this is kind of disgusting. Well, it kind of is, but if you'll take a look, yeah, what has came through your body, ended up in the toilet, is it can tell you a lot about what's going on with your body. So let's take a look at it. And this is really important for folks who are going to go into a healthcare related profession. And so this is the Bristol stool chart. And I know that in nursing school, this is one of the things that we're about to start learning about this week, as a matter of fact. It tells us about the different types of stool that we produce. And so I'm going to go through all seven different types of the stool chart and let you know what it means when you see that. So a type 1 stool, all right, kind of looks like a bunch of little nuggets, all right? They're hard and sometimes they're even hard to pass. And this can let you know that you're very constipated. All right. So you can be constipated for numerous different reasons. Some of it is maybe you're taking a pain medicine, which is, especially opioids has um, one of the most common side effects with those is it causes constipation. And with that, those stools can be hard to pass and can cause you a lot of abdominal pain. You can even see where your belly kind of gets swollen when we see that. And so it lets you know that you're constipated. Oftentimes, what will help with constipation is increasing your exercise, which will help with the motility and getting your stool out. You can also take a stool softener, but you can also increase your fiber intake, and drinking plenty of water will help as well. So a type 2 stool, as you can see in the picture, is lumpy and sausage-like. All right. So the way I kind of look at that is like that old movie um, that came out, gosh, probably way before most of you kids were around, as where they had a baby Ruth that was in the pool, and this was in the movie Caddyshack. And so a type 2 lumpy and sausage-like stool can indicate that you're slightly constipated. And so again, drinking plenty of water, doing a little more exercise, and even having a stool softener may help with that. So what we're really going for is a type 3 stool. This is the one you, just type 3 or a type 4 stool are normal stools. And so a type 3 is a sausage shape with cracks in the surface, and this is considered a normal stool. Now, a type 4 stool is like a smooth sausage or snake-like, and that's considered normal as well. A type 5 stool is a soft blob with clear cut out lead edges, and you can kind of see how that looks in the picture. And so that lets you know that you're lacking fiber. And so you need to increase your fiber intake, right? And there's lots of great ways to increase your fiber intake. It can be just as simple as getting a, a good fiber source cereal in the morning can help with that, as well as increasing how many vegetables that you're eating in your diet. And most of us don't do that. We don't have enough fiber and certainly not enough vegetables in our diet. And so that's a type 5 stool. All right. Type 6, well, this is a mushy consistency with ragged edges. And so this can often be attributed to inflammation, or maybe you have an infection that's causing that. And so that is definitely not normal, but these can happen. It can be simply because of something you ate, and it just means that your GI tract is inflamed. And a type 7, which is one we all hopefully we don't get, unfortunately I had that this week, is a liquid consistency with no solid pieces, and that can also indicate inflammation. And so looking at things in your stool can let you know a little bit about your health and some other things that you can do to improve your health as well. So it kind of lets you know exactly what's going on in your GI tract and what's some things that you can possibly do to encourage your gut health. All right. So I hope this helps, and I hope it helps for any student who are going to be learning a little bit about the Bristol stool chart. And so anyway, a little bit about what your stool is telling you. So what your poo looks like and what it's telling you about your health. I hope this helps. Hope you guys have a great day, and I hope to hear from you soon. Have a great day, guys.